Hello everyone, welcome to Talk Health Asia's Health Chat. So you've recovered from COVID. Some of you may still be struggling with things like tiredness, cannot sleep, keep waking up at night, chest tightness, cannot breathe when you stand up or climb up the stairs without feeling like you're about to burst, right? Now everyone around you, all the aunties, the makcik, you say, "Ayo, something wrong with your lung. Better go scan your lung." But what if I told you there could be another reason for your symptoms that has got nothing to do with your lungs? Now, that's what we're going to be chatting about today, something close to my heart, pun intended, dysautonomia in the context of long COVID. We are privileged to have the leading expert on this topic joining me today, Dr. Boon, who grew up in KL but now living in London, cardiologist and electrophysiologist, Cambridge double first, and he's the clinical lead for the Imperial Syncope Unit at Hammersmith Hospital. Amazing career resume you have there, Dr. Boon, and I found you especially interesting because you're a well-recognized authority in your area of expertise, but you are a passionate advocate for holistic strategies in dealing with dysautonomia and long COVID. So we really want to hear all that you've got to tell us today. Let's start with some basics. In very simple terms, Dr. Boon, what is dysautonomia and how does it relate to long COVID?
Thank you for having me, Pauline. So dysautonomia is the finding that a patient's autonomic nervous system is slightly dysfunctional. And so the question I'll ask on your behalf is, what is the autonomic nervous system?
Exactly.
The autonomic nervous system is that bit of our primitive nervous system. So in fact, there are, in very broadly speaking, two bits of our brain. One is the primitive brain that developed very early on, which is more to do with reflex reactions and also responses to threats. So for example, if you were a hunter-gatherer in ancient prehistoric times, and a saber-toothed tiger or a bear jumped out of the cave, what made you run away is the primitive nervous system, okay? Now, as we evolved a higher nervous system, and that's higher cortical function. And that is our ability to think, to speak, to have complex multi-step interactions in our brain, for example, to write or to build a structure like a house or to think about cultivation or tending your animals. Now, coming back to the primitive nervous system, which is deep-seated and almost subconscious for all of us, this subconscious nervous system is called the autonomic nervous system. And we subdivide those. There are two limbs. Now, we talked about the limb that responds to a threat, like a tiger pouncing. And that is called the sympathetic nervous system, or the fight or flight response. Have you heard of that, Pauline?
Yes, the SNS, right?
That's right. So the fight or flight response will do a few things to our nervous system because that will immediately trigger adrenaline. Now, adrenaline is this master stress hormone. Adrenaline is one, cortisol is the other one. But these two hormones will flood into the system in an instant. So the moment you see a threat, and in the modern world, it may not be a tiger, but it may be crossing a road and seeing a car coming very fast. And immediately you might feel very alert and in a heightened sense of anxiety, but could also be, unfortunately, an email from your boss or a shouting match or an unsettled financial security feeling. Mm-hmm. And unlike our historic past ancestors, where the autonomic nervous system was very, very helpful, and it still is in very short-term threats. So crossing a road and having a lot of moving traffic is good to be very alert, good to have increased visual acuity, increased sound acuity. That means you can hear, you can see better, mm-hmm. and not feeling that you have to eat at the time. Because why would you want to be hungry when you're crossing the road full of threat?
Exactly.
So your stomach shuts down, you don't feel mm-hmm. hungry. And all these simple bodily functions we don't talk about shift to get you a heightened sense of alertness, vigilance to the surroundings, but also maybe your heart will beat that bit faster. Maybe your breath will also be more deep or more shallow, depends, but faster as well. So you pant because there's a threat coming. But when the threat has left, so that you've either killed the tiger or you've run away and you're now with your tribe, you should really dial down that stress. And the problem is, what we have now is that this stress will come 24/7 in an email, in a sense of chronic illness, feeling insecure, having bad relationships, not enough money. All these things give you that constant, not necessarily high level, but low level stress. And that has changed the landscape for healthcare. So I know I digress a bit, but let me talk about the other limb.
Sure.
The opposite, the other limb to the stress or the fight or flight response is the rest and digest response, or the vagal response. I don't know if you've heard of this, Pauline, but the vagus is that nerve, which is the opposite of the SNS. It's the PNS, the parasympathetic nervous system. And that is the thing that makes you truly relax. That's the thing that allows you to sleep.
I'm going to jump in there, Boon. And can you explain the vagus nerve? Is it something here? Of here?
Yeah,
no?
So you have two branches of the vagus that comes down the neck here.
Right.
And then it goes, it's one of the longest nerves in the heart, actually. It comes from the primitive brain, shoots down, and it goes all the way through your neck into alongside your esophagus, with branches to the heart and then to the gut, to the rectum, and all the way down to your toes. But it essentially, like the sympathetic nervous system, controls all the functions we don't need to think about. So for example, when you eat, the vagus nerve activates. Why? Because it wants to then allow your stomach to do a peristaltic movement. That means it squeezes sequentially to push the food down. And if you eat and then you see a tiger, that shift between a parasympathetic or a vagal state to then a sympathetic can make some people vomit, right? Because the stomach suddenly shuts down, doesn't want to process the food. So you get gastric stasis, you get IBS-like symptoms. And I think some of your listeners who have long COVID will start to recognize what I'm talking about, that you are feeling a bit nauseous, you're feeling that your stomach is not working well. It feeds into gut dysbiosis, because when your stomach's not moving and in stasis, bad bacteria will start to grow in your gut and will let out gas, for example, and then you get a lot of bloating. So it all links into the autonomic nervous system.
I see. So if I hear you right, then Dr. Boon, what you're saying is dysautonomia is when the SNS and PNS, the sympathetic nervous system and the parasympathetic nervous system, they're not quite functioning as they should, which means our autonomic nervous system isn't quite functioning. Hence the word dysautonomia. Is that correct?
That's absolutely right. Can I give you an analogy? You know the yin-yang symbol, that beautiful symbol?
Yes.
The yin-yang symbol has a kind of S-shaped line in between, right?
Yes.
If you imagine in dysautonomia, or in a normal healthy individual, just like the symbol encapsulates, the black and the white should be same size. And that implies perfect balance, right?
Yes.
When we are dysautonomic, the S is shifted one way, for example, and you have more black, more yang, less yin, a lot of energy, masculine, aggressive. The yin is put to one side, the parasympathetic, the resting, the feminine, the relaxing. And so this constant state where your ball, your yin-yang ball, is unaligned can also be thought of as a very helpful way to see that you're not in balance. So when you have over-sympathetic expression, or the inability to regulate this S-shaped line left and right in a very fluid way, you have dysautonomia.
I see. Wow, that's a lot to sort of process and digest. So you've explained to us now what dysautonomia is. Could you tell me what are the common symptoms of dysautonomia? I think you mentioned a few things. What are the common symptoms of dysautonomia?
So So I'm a cardiologist, but I have a very broad view of things. And so when I ask the patients, the common symptoms are shortness of breath, palpitations, lightheadedness, brain fog, which is inability to really focus and concentrate, also peristaltic issues, so bloating, constipation, diarrhea, stomach pain. Some people also get temperature dysregulation. Some people feel hot or cold, or too hot or too cold. And some people also feel generally, in my view, it's very difficult to quantify, but very inflamed, very, just not right, waking up fatigued, tired all the time, and just feel like you cannot function because you have muscle aches, joint aches. I think all this can be symptoms of dysautonomia.
So, see, I think that most of the listeners or people watching would be somebody who is having long COVID, or I imagine, knows someone who has long COVID and they're trying to help them. I wonder if let's bring it to that sort of situation. Do you think you can explain to us, perhaps you have a diagram of some sort, why is how does it all work? Like how does it cause that shortness of breath, or the brain fog that you mentioned? Oh, that would be wonderful.
Yeah, so thanks for asking. So I've just prepared this diagram. It's actually taken from a charitable website that I created called stopfainting.com. And your listeners will just be able to get to this website and look at this diagram and some video explainers, including a long COVID tab if they wanted to look at it. But I'm
Great.
just going to try and draw out what happens, okay?
Sure.
So if we imagine, and I'll just annotate with yellow, if we imagine your brain has blood, your heart has blood, and this blood circulates and gives you a
Yep.
blood pressure, and this is your blood pressure trace. So green here is normal, amber is slightly low, red is critically low. In a normal state, when you're lying down, and here I want to qualify, the people with dysautonomia in long COVID tend to have a worsening symptom profile when they're standing up, and feel better when they're lying down resting, especially if they lie down and they put your feet up. And this is one of the cardiovascular signals that I see as a most sensitive marker for dysautonomia. Now, I would say not every long COVID symptom is due to dysautonomia. So we have to be very clear about that. I'm not
Sure.
suggesting that everyone's problem is due to dysautonomia.
Yep.
But if you're a patient and you feel a lot worse when you're standing for a long time, dizzy, lightheaded, palpitation, shortness of breath, chest pain, or you find that whenever you stand up, or especially first thing in the morning, you get the worsening of symptoms, and when you lie down, it gets better, then I think it's highly likely you have dysautonomia. And if that's the case, then this is the process that could occur. So when you first stand up and you have a normal blood pressure, normal hydration status, what happens is that your blood pressure is still good when you first stand up in the first 2 or 3 seconds.
I'm going to pause
But
you there. What's
after,
good blood pressure, Dr. Boon, for our listeners?
oh, I see. So your blood pressure is the amount of force that the heart gives you when it contracts. This is something that is measured by a cuff. So normally your doctor will put a cuff on your bicep, inflate the cuff, you feel that pressure of a wrap
Yep.
round, and then they'll listen to your artery here, and they'll say your blood pressure could be 120 over 80. There are two numbers. One is
Okay.
your high systolic, and the other one is diastolic.
So what is good? 120 over 80 is the good blood pressure levels that we're looking at?
That's right. 120 over 80 is normal. Anything above 140 over 90 is considered high blood pressure. And anything below 100 over 70 is considered low blood pressure. So we have quite a tightly controlled range normally of blood pressure. Okay. So if I say that when we first stand, it's fine, the heart is still full of blood. But what then happens with continued standing is that the blood starts to drain downwards from the heart and the brain, and it drains towards the lower limbs. And in a normal sense, what would happen is that the blood pressure would fall here, as you can see, because the heart is now emptying. And when the heart is trying to generate the force, there's not enough fluid to go around, not enough blood to push.
Right.
So the blood pressure starts to fall, Pauline. And when it
Right.
falls, what happens is that the heart sends a signal to the brain through the autonomic nervous system. So the vagus nerve, but the sympathetic nerve we talked about, sends a signal to the brain, and the brain actually pushes out a fight or flight response. And this is a natural thing that happens whenever we stand up. It's exaggerated when we stand up quickly, or if we stand up and we're very dehydrated, or if we have long COVID. And what happens is that the signal to the brain leads to activation of the fight or flight response. And we talked about this with adrenaline and cortisol secretion, which are the main stress hormones. And this is given to improve your blood pressure. And the way it does this is it causes the heart here to increase its pump function and beat stronger. And that can give you the sensation that your heart is going ba-bum, 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 very strong.
Right.
But it also increases your heart rate. And so you get tachycardia. Tachycardia means your heart is beating faster than normal, 100 beats per minute. And so this sensation of palpitations when we stand up is driven by activation of the flight or fight response.
Right.
So far, so good, Pauline? Yeah.
Well, I don't actually have a background in biology or medicine, so I'm going to ask some silly questions here. With the heart, when it's pumping, so if I hear you right, Dr. Boon, as the blood empties off the heart, the brain signals send the increase or rush of adrenaline. Am I right?
Yes.
And cortisol. And from there, the heart, that activates the heart to pump a little faster. That causes the shortness of breath. Am I following you?
Yes, correct.
Okay, great.
And the heart beats faster. There is a direct effect on the autonomic nervous system. So you recall when I said if a tiger jumps out of a cave, your sympathetic nervous system kicks in and you get high heart rate, but you also get a high breath rate. So you start to pant. You know why? Because you want to prepare the body for an action like running away or fighting for your life. Right. So that's why it's called a fight or flight response. You either flee, you run away, or you fight. And that fight or flight response gets you fully charged for battle or for running. Right. And that means you breathe faster, you get more tachycardic, you get more anxious, more alert, and you shut down your gut. You shut down everything non-essential that doesn't need blood at this time. So your gut, your reproductive system just all shuts down because you want to maximize your chance of running away. And so you breathe quickly to try to oxygenate nicely, right? You want more oxygen. Your heart beats fast to get you more cardiac output. So you have the better ability to push through with this fight or flight response. Unfortunately, in long COVID, what happens is that whenever you stand up, you activate your fight or flight. So there is no threat. There is no tiger. There is no relationship issues. There are no financial, well, maybe there are. But the mere act of standing alone is enough to activate your autonomic nervous system. And imagine if you're standing several hours a day without knowing why you feel so tense, why you feel so anxious, why you get these palpitations, why you get breathless for no reason. This could be the fight or flight.
So let me give you an example of myself, right? I had COVID and I would take a walk and my heart would start pumping like I was running a marathon or hiking for 5 hours. But when I stopped, the heart rate wouldn't come down. What happens? What's happening, Dr. Boon? I'm just trying to draw into practical examples here.
Yeah, so people with long COVID who have dysregulation in the autonomic nervous system can take a long while to normalize the fight or flight response. So for example, when you go for a walk, as you just described, it's very normal to activate a bit of your sympathetic nervous system when we walk or exercise. Sure. But the marker of a healthy autonomic nervous system is when the balance shifts very quickly. So if I try to draw on a different side here,
Yep.
what's going on? Do you remember what I drew earlier on?
Yes, the yin and the yang.
Yeah. So this is sympathetic nervous system, which
Yep.
is let's say aggressive, okay?
Yep.
And this is activity, okay?
Okay.
And this is the parasympathetic nervous system. So this is rest and digest, okay? Now
Yes.
tell me what happens when you run now. When you
Uh,
run,
mhm.
you are expressing more sympathetic nervous system. Normal,
Right.
completely normal, right?
Okay.
But when you stop running in your previous self before you had COVID or
The
long COVID,
balance.
the balance shifts back here very quickly, sometimes
Sure.
within 3 to 5 minutes, okay?
Yep.
And you will know in kind of health talks, if you read, that
Yep.
one of the markers of your cardiovascular health is how quickly you come back to baseline after pushing yourself with
Right.
intense exercise, right?
Hence we have the
So
stress
your
test.
but your autonomic nervous system doesn't allow your shift to be 3 to 5 minutes. It takes much, much longer to come back. So with long COVID, it could take whatever, 60 minutes. It could take 3 hours. It could take 24 hours. Depends on how severe your symptoms are. And you have to ask, what are the factors that can modulate the shift back into the
Mm.
parasympathetic nervous system? And this is where I think the holistic approach and a more enhanced understanding of these autonomic nervous system profiles can come into play.
I love this diagram because I think that's just it's very simple, and I think it will it paints the picture for our listeners as to how all of this is working and relates to us in day-to-day function. What I love about what we had a chat before this video. I love that fact that I mean, a lot of people are taking beta blockers and things like that, but we're talking about holistic approach, and we're going to address that in the next video, in the next episode. But before we do that, one other thing I want to address, Dr. Boon, in your observation, in these couple of years, what is the common profile? Do you see a common profile in the patients who tend to have long COVID? Is there a greater likelihood in patient A or person B in not having long COVID?
So I've spoken to many, many people who take long COVID classes, including physiotherapists, Pilates instructors, yoga instructors, and my consultant colleagues, right? And there is a very clear trait. Now, and I wonder whether you can identify with this, Pauline, and maybe share your own traits. I know this is a bit personal, but we are having a lived experience here, and it's very
Sure.
useful sometimes to share your lived experience. So if I said to you the following things, you tell me yes or no. It's like
Okay,
like
we'll play that
long
game.
COVID
Sure.
checklist 101, okay? So
Okay.
driven,
Yes.
type A personality.
Pretty much.
Explain to your listeners what type A personality means.
So I think a type A. I don't know if I'm. Well, type A will be someone who really is sort of a go getter, isn't it? Like you don't really want to settle for less. You always want the best out of optimizing every situation.
Correct. Optimizing every situation, including getting back to health as
Yes.
soon as possible, because I can't
Impatient.
afford to be sick. Yeah. So a bit impatient, but a bit of a striver and a go-getter and wanting to always be top of your game.
Sure.
Tell me, Pauline, what does that come with? That kind of personality trait, what do you think fundamentally your autonomic nervous system is going to be like when you are always driven and always wanting to take action and react to the world around you? Are you going to be
I
more yin or
I
yang?
I I imagine it would be with that S that you've drawn there. It will be the black part of it would be
Yeah,
more,
yeah.
yeah, as
So
if I'm running
more
all the time.
yang.
More
That's
yang,
right.
right?
And if that type A personality, for example, in work life, gets an email from a boss at 11 p.m.,
Mm-hmm.
is the type A personality or the non-type A personality going to want to respond more quickly so that they show that they're working hard, so that they get the promotion? So I'm just asking a rhetorical question, right? Because
Sure.
the type A personality is much more prone to shifting this way with many, many micro triggers. Shift, shift,
Mm.
shift. Sympathetic, sympathetic, sympathetic. And in the context of long COVID, what we need to do is unshift. So the other more relaxed way is to shift this way. So if we shift the other way, and the situations in which we shift, this way, where we have more yin or parasympathetic and less yang, is when we do activities such as we relax, we go out in nature for a walk. And when you go out in nature, we leave our phones behind because we're looking at the trees and we're feeling the kind of energy of the sun, the sky. And we sleep, we rest, and we be present. Being present means
so important.
Being with yourself and the situation right now. And this also means in the moment. This is a way to shift to yin. And so right now, when we're talking on this webinar, I'm not thinking about my day ahead. I'm not thinking about the research grants that I need to review. I'm not thinking about my emails or my patient queries. I'm just having and enjoying a conversation with you, Pauline. And I'm not thinking that I'm thirsty or hungry or what I'm going to eat or where I'm going to go or how much time I have left in the day. But if I'm not present talking to you and already my email comes in and I hear a ding on the phone and I'm checking this phone whilst I'm talking to you, I cannot be present with you. And I'm not in a truly relaxed state, right? So being present is one of the things that will shift you into the yin type. But coming back to your question, what are personality traits? Those are the major traits. What are physical traits? I'll ask on your behalf. People with a tendency to lowish blood pressure or low normal blood pressure, which means that people who have maybe had a tendency to feeling a bit dizzy when they were younger, when you're dehydrated, standing at assembly or doing a march as your scout or girl guide, or doing a trek, or just standing for a long time in a queue and you feel dizzy sometimes. Those are the kind of physical traits with low normal blood pressure, together with a tendency to be a camel, like not drink very much water. So those people who don't drink water, who don't look after their physical self, who don't sleep that much, who have a background of low blood pressure with the type A type personality, but also very driven, these are the susceptible individuals to long COVID in my experience.
It sounds just like me, but I think that'll be revealing a bit too much of myself, Dr. Boon. That's very interesting. And is it more females than males, or is it pretty much the same in your observation?
In my experience, it's a little bit more females than males. And I still can't explain exactly why. There may be a link to the menstrual cycle because I don't know whether you want to get into this, because during the menstrual cycle, there are vascular changes that happen to potentially reduce your ability to hold on to blood. So, well, A, you're menstruating, so you're losing blood, but B, the hormones that are changing at the time of the monthly cycle can cause your vessels to be more relaxed. And so you pull more blood, P-O-O-L, you pull more blood into your lower limbs when you stand up at the time of your monthly cycle. So some people with long COVID will get much worse symptoms during that time of the monthly cycle, or -5 days from the menstrual period. I don't know whether you have this experience, but you don't have to share.
Yeah, sure. That's all very interesting, and I think that you've explained really well for us today. All this the malfunction really of the autonomic nervous system. If you've enjoyed listening to Dr. Boon explain dysautonomia today, I highly recommend that you get yourself a copy of his book, Keeping Your Heart Healthy. It's written by Dr. Boon himself and available for sale at your nearest popular bookstore. He explains the different aspects of cardiac health, about how the heart physically, and it's really easy to understand. So highly recommend, get yourself a copy. Dr. Boon, I think that's all the time we have for this episode. Guys, if you're listening on Spotify or watching on YouTube, leave us a comment about your own dysautonomia or long COVID journey. Tell us what sort of symptoms you have been suffering so we can empower one another. And join us for our next episode where Dr. Boon will talk us through the holistic measures that have really worked for many around the world, myself included, so you don't want to miss out on that video. I'm Pauline Lim. See you soon.